occasion of World Hepatitis Day, I welcome you because today every individual, whether doctor or paramedic staff, those involved in the pharma industry and our patients should all work towards making this world hepatitis free. And today is one day that reminds us that this is one disease that actually needs to be eliminated, because hepatitis C in India itself is about 3 to 3.5% of population is suffering from hepatitis B. It is not just that one has hepatitis B that we want to eliminate it. We want to eliminate it because the virus that stays inside us leads to damaging the liver, causing cirrhosis, and thereafter leading on to creating liver cancer. Therefore, it is of utmost importance that we get rid of hepatitis B and C, but today I am emphasizing on hepatitis B, that this scroll gets eliminated and we become free from the fear of developing cirrhosis and hepatocellular carcinoma. It is also very important to remember that only 10 to 12% of the population that is positive for hepatitis B is aware that they have got hepatitis B. So you can imagine that over 80% of our population that is infected with hepatitis B does not even know that they are infected with hepatitis B. And therefore it becomes very important for each one of us to make this awareness almost national and create this awareness not just on World Hepatitis Day, but every day that we sit in the clinic or we interact with the population. Of those who are aware, only 20 to 25% are on treatment. So not only are we behind in creating awareness, we are behind in initiating the treatment also. It is important to know that the diagnosis of hepatitis B can be very simple. A small finger prick, 1 drop of blood, not more than 3 minutes of putting it on a strip will give us the answer whether somebody is infected with hepatitis B or not. The test is called as HBsAg. So if one has to first step in diagnosis is to find out whether the public or the person is positive for hepatitis B through being HBsAg positive. Those who are HBsAg positive will then be guided by their doctor to get the viral load to see how much is the virus. The good part, the best part of hepatitis B is that it is not only treatable, even if the treatment is prolonged, but it is preventable. And therefore, each one of us, other than diagnosing those who got hepatitis B and then treating them, we must be aware that all pregnant ladies should be vaccinated for hepatitis B so that their children do not get the virus. It is very encouraging that the children below the 5 years of age, which were earlier almost 5% of population being positive, are now only 1%. And that is thanks to the virus vaccine for the virus which is now available. The transmission occurs through bad injection practices, blood infected with hepatitis B, needles which are not cleaned and used, and from mothers who are positive and they transmit it to the children. When a child gets infected, there is 95% chance that he'll become chronic hepatitis B patient. When we get infection in adulthood, the chances are only 5% that we'll become chronic. There are a lot of good things about this, that we have a vaccine which we do not have for hepatitis C. So dear friends, today on World Hepatitis Day and every day thereafter, let us make a pledge that we will vaccinate, convince people to be vaccinated as much as possible, convince our patients to be vaccinated if they have not been vaccinated. We convince our patients to get tested for hepatitis B. We convince those positive for HPSAG to take the treatment. We convince those who are on treatment to be on regular follow-up. And I'm sure with the WHO guidelines or the WHO desire to make the world hepatitis B free, all of us, you, me, and our patients will ultimately achieve this goal. Thank you.